This is the Thriving Dentist Show with Gary Takis, where we help you develop your ideal dental practice, one that provides personal, professional, and financial satisfaction.
Welcome to another episode of the Thriving Dentist Show. I'm Gary Takis, your podcast co-host. We're doing a little bit of a different episode today. If you're a regular listener, you know that I alternate formats back and forth. And one of the formats that I do on a regular basis is an interview format. And I have a very special guest today, Ed Zuckerberg. Hey, Ed, how are you?
I'm great, Gary. How are you doing today?
I am doing fantastic. I'm excited to have you on the show because you have some wonderful background in dentistry and also in what we're going to call your second career, which is kind of related to dentistry, of course. But I suspect that all of our listeners know who you are. But there may be some that been in a cave or been under a rock, and they need to know who you are. Would you be kind enough to start and share a little bit about your background? And we're going to have a ranging discussion today, talking about a number of different topics. We're going to talk about your background. We're going to talk about technology. We're going to talk about the oral systemic connection and some of the cool things that's happening there. And I think this is going to be a listen that is going to be valuable for all of our listeners. So with that intro, would you be kind enough to share a little bit of your background?
Happy to do that. And, if the train goes too fast, just slow me down.
No worries.
I'm a Brooklyn boy, born and raised, and I went to NYU dental school, took the subway, lived at home until I got married, which was, a year or so after graduating dental school. 1978 grad, so we passed our 45th anniversary recently.
Yeah.
I'm hoping to make it back to New York in October for the reunion. So if any of
For
my
the 50th,
friends,
that's an exciting milestone.
Listening, I hope to see you there. So I did a residency at the Brooklyn VA hospital, which was a great year. I mean, the VA hospital was pretty tight on money for Crown and Bridge, but I think I did about 500 surgical extractions, a lot of perio surgery, a lot of endo. They had actually lost their oral surgery accreditation. So they had a senior resident, but no underlings. He was by himself running the whole program. And he had permission from the head of the department to get one of the GPRs, really involved. So instead of my one morning a week, I spent probably half my residency with him, doing everything from LaForte osteotomies, apicos on palatal roots of upper molars, and full bony impactions, you name it. It was great.
And that was right at the beginning of your career.
That was in my first year out of dental school. As a matter of fact, I actually put in an application to do an oral surgery residency at Cumberland Hospital at the end of my year. Most people do it at the beginning. So I knew I'd have a year hiatus. And I actually fell into my first practice in Brooklyn, right around the corner from where I grew up, where my parents still live. There was a dentist who was fleeing to upstate New York who, I literally shook hands in an hour of meeting the guy. He sold me his entire office with 400 families for $5,000 in 1979, equipment and everything.
I'd have to say,
and my father walked in with me and was there the whole time, of course, not really saying much, except on the way back to the house, which was a block and a half. He said to me, "I can't believe you gave him what he asked for." I said, "Dad, it was $5,000. What am I going to do? Offer him $3,500?"
I'm sure your father said, yes, that's what you should have done.
Well, anyhow, from there, my wife I got married 6 months later. My wife got into medical school in Westchester County, New York Medical College. So we relocated to Westchester, loved it there, and ultimately bought a home office from a retiring dentist with one chair house practice I ran both offices for about 10 years and then sold the office in Brooklyn to focus on the Westchester practice, which was in the house, because I wanted to be there for the family growing up. And we expanded the house to a state-of-the-art practice, 4 ops. I made it my business to be upstairs at 5 o'clock every day, dinner with the family, time with the kids after dinner, sometimes late dinner with the wife, and then tuck everybody in. And I was a night bird, so back down to the office at 10:30, 11 at night, and frequently not turn into bed till 1:30, wake up 7:30 for an 8 o'clock patient. Basically roll out of bed, quick shower, throw some clothes on, and get my hands in a mouth at 8 o'clock. And
Yeah.
it worked great. It was a great setup for a career and for balance of family life.
And now, for our listeners' benefit, you and I share many things in common, but one of the things we share in common is both of us have four adult kids. So your family included 4 kids, and mine includes 4 kids.
Yep. And that was, our path to that was an interesting one too. We bought the house in Westchester in '81. My wife had about a year under her belt in medical school and was pregnant with our first child, and delivered her on February 28th of her second year in medical school. Perfect timing, because she had the whole month of March off to study for part 1 of the national medical boards at the end of March. So she didn't miss a day of medical school.
Wow.
And 2 years later, 2 weeks before graduation, she delivered our son Mark, who most of the listeners probably know, or know of the name. There was one gentleman in South Dakota who about eight years or so ago had not heard of my son Mark. And I guess I made multiple references to Mark in Facebook during the lecture. And at one point, this guy raises his hand and said, "You keep making references to Mark. Who is this person?"
Who is this Mark?
My wife, who was in the first row, just started laughing hysterically, as well as the other half of the audience as well.
I think it's safe to say, Ed, that our listeners will recognize who Mark Zuckerberg is. I think our listeners will have that all over the world, as a matter of fact.
Anyhow, my wife took some time off after she finished her training, 10 years to be exact. We wound up having 2 more that she was able to be home with from the beginning. And then she went back later on in the mid-90s. But that didn't work out that well for her. Managed care had actually destroyed the practice of psychiatry way earlier than it had a significant dent on dental practice.
Yeah, I know that history, Ed, and you're absolutely right. If we think back to that time period, healthcare was going through a radical transition, and she had that hiatus, and she experienced what it was, and now what it came to be. And I imagine that was a big change for her.
It was big, and it really made her question her career choice. She had a real tough time with that year. At the same time, I'm home. I engineered my schedule so that I didn't see patients from 3 to 4 o'clock, although my hygienist did. And I would be there to greet the kids since my wife was at work, and triage anything that went on that day, make sure everybody's got their focus on whatever homework they've got to do and whatnot. But all the while, I'm a bit of a control freak. So I was doing everything in the office, overseeing staff, supply ordering, plus all the clinical stuff. I just had a lot of trouble giving out the delegation that I really needed. And I'm planning to myself and plotting, and I sprung this on my wife about a year later on a vacation, on a couple's vacation in Bermuda. I proposed to her coming home, leaving her career to run my office, everything non-clinical. You be in charge.
Okay.
And Um,
Well, I
and
imagine, you picked a alluring location to have that conversation.
yeah, well, and the prospect of being there for the kids, and I said, between my staff and the patients, you'll have more than enough to practice your skill set on. And I didn't realize, I guess the staff was probably a little antsy in the beginning. Oh, the boss's wife is coming in to run the show, what's that going to be like? But one particular night, about 3 weeks after she'd been in control, we're having dinner, and she looks at me and says, "So is it going to be you or me going to fire the hygienist?" And I had no idea this was coming. And I'm going, "What are you talking about? She's an amazing hygienist. Do you know how hard it is to get a good hygienist? The patients love her." She said, "Your staff hates coming to work. Nobody smiles. Efficiency is not what it should be." So I started, I earned the confidence of them slowly, and I started talking to them. It turns out she's physically abusing one of your dental assistants. She takes 10 minutes to turn her, we had three working ops, two of which I used and one for the hygienist. And 10 minutes was too long for the assistant to turn the room over. There's a lot, everything's got to get wiped down, plastic replacing, just, the rule, the game.
Yeah.
And on more than one occasion, she physically shoved her against the wall and said, "Get out of the way. I'll do it myself. And half the time you do it."
Not a conducive team building environment.
I had no idea this stuff's going on. Right.
By the way, Ed, I can safely say there are thousands of dentists listening to this right now, nodding their head because they've likely experienced something very much like that.
And as shocked as I was, that's how shocked the hygienist was when I called her into my office the next day and told her I was letting her go. Within a couple of weeks, I started noticing people whistling, people smiling, people not running home at the last patient, dealing with stuff, calls they had to make, to make sure things were going smooth. It was like an office of people who wanted to be there and do what they wanted to do.
Imagine that.
It's incredible. And, they went from dreading the boss's wife being there to basically becoming like their personal therapist, for their, boyfriend, husband issues or parenting issues or whatnot.
Sure, family.
And, it was just also, I came to my wife shortly after that and said, we have the ability to transform something here. There's one thing that, really bugs me, I do great work. I'm painless. As a matter of fact, everybody used to tell me when I left, "You're painless, Dr. Z." And that's how, when we built our website in, I think it was 1996 for our practice, I grabbed painlessdrz.com. That became my, my thing.
URL, yeah.
But I said, despite being painless, I still get "That was great, doc, but I hope I don't see you again for a long time," kind of thing.
Sure.
And I said, can we tackle this issue of making going to the dentist be a friendlier thing? So it was a combination. We used a combination of dealing with every single kind of, my wife obviously interviewed everyone. What don't you like about the office? White jackets in my office disappeared. Okay. Our front area is basically like a living room coming into someone's house. It is my house, but it is a reception area, but no doors, no sliding glass windows or anything like that. Open communication between the staff and people in the reception area. TVs, amenities, like hot towels and their favorite magazines and things of that nature. somebody said, I don't like the dental office smell. And Karen said to me, what is that smell that everybody equates with the dental office? And I go, well, it's two things that I could think of that are the most pungent in the dental office are cloves from the eugenol and methacrylate from the acrylic temporaries.
Yeah, I was going to throw up eugenol as one of the options. Yep.
Yeah. And you know, I didn't do a lot of temporaries, but I remember in dental school, one of the things they did was they mixed up a big batch of ZOE. And, you know, an occlusal amalgam in dental school was like 2 visits, right? It was like 1 visit to prep meticulously, and then, you know, it was 3:45. You didn't have time to place the amalgam because that was another whole thing. So you'd wind up then slapping some ZOE in there. And then the next visit was another 3 hours just to prep out the ZOE and finally get around to filling the tooth with amalgam. But we did use, you know, eugenol for temps. No more after that. Got rid of that smell completely. The sound, of course, that's an obvious one, right? The noise of the drills. So we had one of the early Novatone systems with the headphones. You know, patients could listen to any one of 5 different kinds of music and whatnot. And
well, it won't come as a news to any of our listeners that you are. I like to think of us as fellow nerds, and I'm using that nerd moniker as a compliment. Ed, you love technology, and you've embraced it throughout your career.
So, first IBM PC XT in 1986. AccuCam, late 80s. I've come full circle now because the guy who built the AccuCam is now pitching his first generation of ultrasonic periodontal probe to me some 40 years later. Air abrasion in the early 90s I saw as a great way to further our, you know, care for phobic patients. You know, kids treat fillings without a drill using air abrasion. Phenomenal. You know, and along the way, technologies like digital radiography. In 1998, I was probably one of the first kids on the block to have that. I wanted to build digital record keeping, and there was nothing available for dentists in 2005. So I set out to build that myself, along with the help of my son-in-law. Not my son. He was already involved with this other project called Facebook by then. But I had a son-in-law who was also a techie who helped me build that. One funny story I will tell about my son and his impact on my office went back to 1996 when he was 12 years old. As early tech adopters, we were already doing electronic claim processing, credit card processing, all kinds of stuff where we could through a dial-up modem in the early 90s.
Right.
And my assistant noted that in 1996, that funny thing was going on. She goes, after 3 o'clock, I have a hard time getting a patient eligibility verification or getting a claim through. And what is it about after 3 o'clock? Well, it didn't take a rocket scientist to figure out that Mark and Randy, who had their own computers in their room, were now home from school and were going on America Online, which was the way to get the internet, you know, cutting into our bandwidth.
They were using all your bandwidth, weren't they?
So I put in I had a T1 line put into my house in 96. So we had full-time broadband. And Mark was like at a perfect storm. He was 12 years old and at an age where back in 96, where most families had one computer that was shared among everyone else, he had his own computer with 24/7 full-time broadband and the ability to figure out how to make 8 computers that were in the house and office talk to each other.
Wow.
And at dinner one day, I was discussing the ComLight system that I was thinking of having put in to the practice, you know, a system of communication from one op to the other. And he's like, well, don't they have to drill wire, you know, run wires into all your rooms to do that? And I go, yeah. And he goes, well, you already have Ethernet. You already have computers in all your rooms. Why would you need that when you could communicate through your computers? And I said, how hard is that? He goes, well, I think I could probably build you something in less than a week. Well, he went working on it that night and he had it ready in a day.
Wow.
So the next day in my office, ZuckNet was born. And we had our own inter-office communication where when my hygienist was ready for an exam, a little pop-up window would pop up on my computer and she could even type in a note. And oh, by the way, I told her number 19, the amalgam is too big. She really needs a crown. So that was the, my first introduction to the kid's ability to take what knowledge he learned from computers and transform it to that world.
Something practical and usable and something that served you. Very cool. I did not know that. That's very cool.
It's already doing some beta testing and lecturing for one of the early digital x-ray companies was right in my backyard in Elmsford, New York. And then I was also involved with the early foundation of Aura Pharma with their Arrested.
Right.
And I was doing some lectures in not my best experiences lecturing at Ruth's Chris to a group of dentists who had been working on patients all day, and then we fed them a steak dinner and red wine and then shut the lights. And I was expected to now entertain them for an hour with 100 of the most boring slides that Aura Pharma gave me to discuss Arrested. So that was a challenge.
That wouldn't be my choice of environment or lubrication for them.
Yeah. But fast forward to about 2010, and I'm still practicing full time, and I get a phone call that gets through my my tiger of a dental receptionist up front. She was such a tiger that somebody once called and asked for Eddie. And she put the call through, and later she said, that was a friend of yours, right? And I said, no, it was a salesperson. And she goes, I am so sorry. I won't fall for that trick again.
It got me.
About a month or two later, I found out from my mother that my receptionist had hung up on her when she asked for Eddie.
Oh, no.
But she said,
it's useful to have a guard at the gate. It's useful to have a guard at the gate. But now your second career was after over 30 years chairside clinical, right? I mean, 30 plus years.
Absolutely. I mean, and it got launched by this phone call from Howard Ferran in 2010, and Howard managed to get through. And she comes back and says, there's a guy by the name of Howard Ferran who said you'll take his call.
Oh, that's classic Howard. Yeah, I could hear him. He would pull that off. He would pull that off.
Oh, yeah. I was between patients, and I said, yeah, I know Howard. I use his website. I'll definitely talk to him. And Howard's like, I've never met Howard before. We've never had a discussion. We've never had an email together or anything. And he's like, Ed, you're a dentist. That was his first words out of his mouth. And I said, Howard, I kind of figured you were smart, but you just clenched it for me.
You got it.
Now,
Howard is very street smart. And I mean that as a compliment.
Howard was trying to become friends on Facebook with every dentist in the world. Yeah. And Facebook told him at a certain point when he reached 5,000 friends that he couldn't have any. And I said, well, Howard, you're using the wrong vehicle. You're using a personal profile instead of a business page where you can have millions, everyone. He said, oh, what do I do? And I said, I think there's a conversion program we can run that'll convert your profile to a page. You'll lose everything on the profile. So if there's any pictures or anything you want to save, back them up. But what'll happen is all the people, your 5,000 friends, will become fans of your page. And now you can go on your merry way becoming friends with everyone. So I helped him do that. He was thrilled. He says, Ed, you need to write an article for Dental Town. Does my office need a Facebook page? and then a few months later, Ed, that was great. What else can you write about? I go, well, I'm pretty passionate about technology in the office. So wrote a follow-up article. I think it was something like how I learned to put down the sledgehammer and love my computer, or something like that.
Yeah.
One dentist journey with technology. And shortly after that, I started getting some calls and emails from dental societies, from my alma mater, NYU, Columbia Dental School. Hey, would you lecture to dentists, and I go, sure, with some trepidation, because I didn't know if, I would enjoy it, if they would, if I had worthwhile stuff to say. Turned out the answers to both of those questions was yes.
Absolutely.
And around the same time, we already had 3 kids in California by then. So Mark started Facebook and moved out to California in 2004. About a year and a half later, he convinced our oldest daughter, Randy, who actually did graduate Harvard, unlike Mark, who dropped out.
Right. Famously did not.
Yeah. I mean, how my wife and I, who both went to Brooklyn College, got, 2 kids into Harvard is still a mystery to us. But probably my wife, she's got the brains in the family. But anyhow, Randy had spent a couple of years in marketing for Ogilvy and Mather and Forbes, and was doing some visionary early, stuff on video and webinars and stuff like that. And Mark brought her out to become, head of marketing at Facebook. And then my youngest daughter, Ariel, who was finishing a career, her college education in 2011 at Claremont McKenna, decided to minor in comp sci and wound up getting a job in Palo Alto with a startup that was doing social media campaigns for Fortune 500 companies. So we have 3 kids living in Palo Alto. One's still on the East Coast going for her PhD at Princeton. And now Randy's giving birth. And the night of the phone call, I'm finishing the afternoon. I'm finishing up on a Saturday afternoon treating patients in my office in Dobbs Ferry, in our home office. And the call comes through that her water broke. And we got on a 7:00 flight from Delta's last flight of the day to San Francisco. We were there at 10:30 at night, California time. And shortly after midnight, my wife's holding our first grandchild.
Wow.
This is 12 years ago. And she looks at me and says, I'm staying. Are you coming? And I'm going, we have a house in New York. We have a dental practice in New York in the house. It's going to take some doing, but yeah, I'm ready.
We're in for this. Yeah.
Took a couple of years, and I certainly wasn't ready for another career in dentistry as a full-time dentist after 35 years. So around that time, there were lots of calls to lecture. There were calls from companies with really cool technology. Can you help us get this to market? One company had a breath device. It was the company was called Breathometer, that measured hydrogen sulfide gas in the mouth and determined your from your breath. It actually scored your breath from A to F. And it did it in a kind of cute fashion. Like if you were A, you were kissable.
Okay.
If you were D or F, it's like, don't come near me, that kind of thing.
So kind of a playful way to report.
I immediately had this vision because, and I'm going to come back to this in a few minutes, but one of the most frustrating things for me in my career was perio. I mean, I was, from my background in the VA, I always did all my perio in-house. And we did, aggressively treated everybody who needed perio, SRP, flap surgery, you name it. As a matter of fact, MetLife cited me in 1994, partially because I was an early electronic claim submitter, but they sent me a form letter that said that they've identified me as someone who's doing way more 4341s than my colleagues. And I'm
A
like,
utilization. So
and
this
I'm,
was a,
I'm like smiling to myself. I mean, oh, you mean you've identified me as someone who's doing it correctly, and all my colleagues are undertreating.
and you
Because
were looking for the ribbon. You were looking for the ribbon they were going to give you.
yeah, right. Instead, they punished me by saying we're going to require for 1 year perio charting and x-rays to accompany every 4341 claim, because up until that point, they were paying 4341 without any documentation.
Right.
So now, again, getting back to perio, one of my frustrations is getting people to really understand the nature of periodontal disease as something that's with them for life, that they need to be partners in the treatment. It's not something we can fix.
They're not cured.
And it's exasperating. Yes, it's financially rewarding. You treat a patient, but it's not a feel good when you don't see them again for 3 years, despite your best efforts to educate them and send them reminders and try your best to get them to participate in their own care. And the next time you see them, it's like you didn't do anything for them. Right. And they need it all again. So
seems like a futile pathway, doesn't it?
What I envisioned is showing someone that their breath was like D or F because they've got this, horrific periodontal condition, treating them, and now showing them they puff into this thing in their A and B, and send them home with it, give it to them. And as they get near their 3-month recall, we send them a reminder to, let us know what your breathometer scores are. And they notice their breathometer scores going that had been A or B right after treatment is now becoming C or D. And they realize that it's related. And then nobody wants to have bad breath and whatnot.
What a cool change motivator to motivate change in your patients.
So I dealt with companies like that. I dealt with companies that were on the early cutting edge with AI and dental x-rays. Really funny story how I got started with one company called Retrace, who actually predated the market before some of the ones that people are more familiar with now that are out there, Pearl, Overjet, companies like that. Retrace is not a household word because we've chosen to go through insurance companies. But I was actually playing at a bridge tournament down in Orange County. One of my passions in life, and especially during my so-called retirement years, is playing competitive contract bridge. That's when I really use my brain. And my wife says, "You're not going to believe this, but we got you got a pitch in the mail." But, well, no one knows our address where we live because, we bought the house under an LLC for anonymity. Otherwise, we'd have every other crazy person who's trying to reach my son, at my door, ringing the bell or mailing us stuff or whatnot. She said it was in a plain unmarked manila envelope. And there's a legitimate x-ray, a dental pitch in here. And the guy says he's actually our neighbor. He lives across the street. He had no idea who his neighbor was until he got some of our mail by accident.
Oh, okay.
So then he goes, "Oh, that's who lives next door to me? Maybe I can, take the liberty of sending him this pitch." So they're doing AI and interpretation of radiographs, in which, this was unheard of like 6-7 years ago.
Oh, yeah.
And they're telling me they've got this database of thousands of x-rays. They're working with UCSF. And I said, "Well, what if I send you some of my own x-rays?" He goes, "Yeah, no problem." So I don't tell him who they are, but I give him a bunch of bite wings and periapicals from my wife, Karen. And I was especially interested what the report was going to say on tooth number 11, because I had done a very deep DL composite restoration about 4 years prior, very close to the pulp, so I had a, Di-Cal, a big thick base in there before the composite. And on the x-ray, it looks like there's a recurrent caries, but, you know, I know there's not, and it hasn't changed in 4 years, so I know it's all kosher. And the report comes back, and I'm reading the blurb. There's a blurb on every tooth in the mouth, and I'm reading the blurb on number 11, and it says with a 96.3% degree of reliability, tooth number 11 has an intact composite restoration with a radiolucent base underneath. And I called him up and I said, I'm happy to sign on as an advisor for the company. So, so, you know, that's the kind of thing I was doing. And it was really spending my time, you know, brainstorming with people on the phone, meeting people for coffee. Sometimes it meant trying out a product or a technique. Like I helped put the Chow pinhole surgical people on the map. They'd been around for a while, like 15 years, and I never heard of them. And when they came to me and said, we'd like you to help us, and I said, well, who are you? And I looked them up on the website, and it looked really interesting what they were doing. I asked a bunch of my colleagues, you know, who are on the cutting edge, you know, people who are out there lecturing and stuff like that. And nobody has heard of Chow Pinhole, even though he's been doing this since the mid 90s. And I call the guy back and I say, wow, you're doing this stuff. This looks really cool. I've never heard of you, and no one I know has ever heard of you. And I said, that tells me one thing. I hope this is clean for your podcast. But I said, that to me, that means your marketing sucks. Okay. And he starts laughing and he goes, well, why do you think we called you? So
and that's why we called you.
That's right. So I said, well, I can't get behind, I can't help you with something that I don't know if it works. So they invited me down. I went down to Pasadena. It was a great weekend. They put out a great course, a whole, you know, a 2-day course, phenomenal. You know, we learned the technique on a cadaver and on a pig's head. And they gave me an instrument kit set up. I had my office that I was doing a little bit of work for in the Palo Alto area, scheduled some patients for me that had severe gingival recession. I did a bunch of surgeries. They all worked well. It was easy to do. The results were great. And I said, I'm in. Let's go. So, you know, I like to think that now more people have heard of the technique and that, you know, I help them with advice and get them on that pathway. So, you know, I need an office to still do some work and keep skills sharp and treat some patients when I'm evaluating products. But I thought this was all coming to an end when the pandemic started.
Right.
And you know, I'm not going to lecture anymore, you know, and frankly, you know, most of my lectures up until then had been on social media and technology, and now just about every dental office is pretty savvy on social media, and everybody's adopted technology, you know, in one form or another. You know,
right.
I did lecture in Savannah not too many years ago, and some guy came up to me at the lunch break and goes, "You Northerners got to slow down. We do things slowly down here. We're not up to stuff like you guys." And I'm like, well, give me an idea where you are technologically, so I know, so I can maybe tailor my talk a little better to you.
Sure.
And he's like, well, we're thinking of getting our first computer in the office.
There you go.
I'm like, okay, I don't think I could slow it down that.
I don't think we can slow it down to analog.
But instead of riding off into the sunset, I get a call from a guy by the name of Jeremy Krell. And I had met Jeremy a couple of times, I think at the Yankee Dental meeting in Boston and Chicago midwinter when I was lecturing. And I knew we shared something in common. He was like me, a serial entrepreneur advisor, startup advisor. I think he was the chief dental officer for Quip, one of the, you know, the first at-home toothbrush. Jeremy was feeling the same pains that I felt with most of our startups. At some point, they need money. and getting money, you can get to like a certain stage with friends and family and things like that. But at some point you need VC money.
Yeah, so your bootstrapping can take you so far. By the way, Ed, many of our longer time listeners will recognize the name Jeremy Krell. We've had him on as a guest contributor in our top clinical tips segment, where he'll give a quick 5-minute clinical tip. And Jeremy's been on a number of those segments on the Thriving Dentist Show over the years.
Cool. Well, anyhow, Jeremy and I hit it off, and he told me what he was doing. He was forming the first venture fund that was dedicated solely to investing in companies involved in oral healthcare. And I said, it sounds like I'll be doing pretty much what I'm doing already, but in a more organized fashion, that I will have other dental industry KOLs to collaborate with and discuss, what I see. Maybe they'll see stuff I don't see, I'll see stuff they don't see. That was the plan. And it kept me really busy with Zoom calls during the pandemic. And we now look at almost 100 new companies every quarter, and we only invest in 4. So we've been going about 3 years. We've already had a couple of early acquisitions. One of our early funds had a company that we invested in, got acquired literally within a couple of months after we invested. Most of our investors to this point, while we're starting to get institutional money, most of our investors are dentists like you and I, Gary.
Right.
Who put, who put like, 10,000 a quarter into a fund that invests in 4 companies each quarter. And basically designating a part of their portfolio to really what they know, and putting trust in some of the top names in the profession to help pick the cream of the crop of companies to invest in.
I know the name of that company. Ed, would you be kind enough to share it with our listeners?
It's Revere Partners.
Revere Partners.
And I'm sure most of us can resonate with that name. I assume most of us know that Paul Revere was a dentist.
Yeah, I want to exactly. So we have a good connection there, both in terms of messaging, but also from a dental background. There you go. Let's take a leap, and I want you to share a little bit about the stuff you're doing with Keystone Bio, because it is, to me, it's a wonderful platform for you to share what really has been a career-long interest and passion on many different, not only clinically, but technologically as well. Talk a little bit about Keystone Bio and some of the things you're learning that I think all of our listeners need to know about.
So independently of Revere, I was also working with another outfit called Angel MD that primarily also raised, funding money for startups, but mostly in the medical profession. And they were just developing a dental arm. So they asked me to put together like 25 dental KOLs, but it does dentistry on a very small scale. And we only do like 1 event a year. And in between events, they said, we've got a company we'd like you to look at. It's not your usual cup of tea. I know you usually like, newfangled technology and stuff like that. This is not about high tech, but it is potentially, we think, interesting and groundbreaking. Would you take a look? And who am I not to look at anything? What's a phone call, right?
Yeah.
So I meet the team at Keystone Bio, led by Dan Sindelar, who's a St. Louis-based dentist. And Dan was actually one of the co-founders of AYASH.
Right.
And Dan had picked up on some interesting literature and some interesting stuff in the literature going back to 1995 that he shared with me on this call. And first of all, he hit me with the initial hypothesis that the bacteria P. gingivalis, which every dentist has heard of, but I don't know how many of us really understand, what a critical player P. gingivalis really is.
PG is absolutely a factor.
Yeah, without a doubt. I mean, George Haji Shingalis and Rich Darvo, two periodontists, had published some papers about 15 years ago on the topic was the keystone pathogen hypothesis, that periodontal disease was primarily the culprit of one bacteria. And that bacteria was P. gingivalis.
Right.
And P. gingivalis is a bug that is present in high levels in 50% of the population over age 30 and 83% of the population over age 60. We're talking about very high levels.
Right.
Now, you can have PG in your mouth and not have periodontal disease.
So it's not, you can have it in the mouth and not have it manifesting disease status.
Right, right. In other words, if you've got a relatively healthy microbiome with a good balance of bugs, the good bugs keep the bad bugs in check. The problem occurs when you have periodontal disease, because P. gingivalis takes a foothold in the subgingival microbiome, in the biofilm. And it's being an anaerobic gram-negative bacteria. The subgingival tissues are the perfect breeding ground for P. gingivalis.
It doesn't get more fertile than that.
But one of the it's super highly evolved. It's so highly evolved. It's one of only 2 bacterial organisms, and this is something I've learned only in the last 2 years. The other bacterial organism is H. pylori. H. pylori is basically a gut bug.
Right.
The way our body's immune system works is most of these bugs secrete from internally a lipopolysaccharide coating over their external structure. And our immune system detects the lipopolysaccharide coating, which trips out or starts the immune response. Send in the lymphocytes, send in the T cells, let's clean this up, baby, right? Well, H. pylori and P. gingivalis have evolved mechanisms so that their LPS goes undetected by our immune system. So no antibiotic in the world.
The cavalry's not coming.
No antibiotic in the world is out there to eradicate these bugs. And they basically grow unchecked. Now, what makes them super virulent, and this is where other bad bugs come into play, is they interact with the other bugs in the subgingival biofilm, and they extract DNA, share DNA with the other bacteria. So most of the listeners are probably aware of a company called Direct Diagnostics. They had a test called the HR5, or the high risk 5, that tested for P. gingivalis, actinomycosis aggregatibacter, fusiform nucleatum, a couple others. And all these play a role. But the role they play mostly is to feed DNA to P. gingivalis.
We're back to PG.
So now what happens is, now P. gingivalis wants to create the ideal situation for it to thrive in the gum tissues. And it's got to cause inflammation. It thrives when the tissues are inflamed and acidic. And the way it creates the inflammation is through outer membrane vesicles filled with toxic proteins. So if you look at an electron micrograph, and this is a podcast, so there's no point in my sharing it with you now, but we can put it up on a shared if you post, if you have a group that you can post on. I'm happy to share this photo, which explains it.
We'll put that in the show notes. Of the podcast. So if you'd like to see that, you just go to thrivingdentist.com, look for podcast, click podcast, scroll down to this episode and we'll put that photo right there.
Yeah. So each organism times how many millions of P. gingivalis is secreting literally thousands of these outer membrane vesicles filled with this toxic proteins called gingipains. Okay. And look it up. I didn't make up that word. Gingipains are toxic proteins secreted only by the bacteria P. gingivalis. And those gingipains fill those gum tissues surrounding the biofilm, cause the inflammation and the bleeding and whatnot that creates the ideal, perfect environment for PG. Now, kind of accidentally, every dentist knows that when you've got inflammation, you've got dilated capillaries and local blood vessels and make it easier for bacteremia to occur. P. gingivalis is not interested in traveling anywhere. It's got its greatest home right there in the gum tissue and the biofilm.
Right.
But those toxic proteins are there in such quantity and excess that they just get spewed into the bloodstream from the gingival tissues. And that's the key to understanding how gum disease and disease in the mouth causes systemic disease. And what I'm going to say in the next few minutes is something that I will bet that 99% of dentists have never heard before. Okay, so let's start with the brain. We've got a very evolved structure to keep our brain and spinal cord healthy. It's called the blood-brain barrier. Almost no organism can pass through that barrier, with the possible exception of meningococcus, which is why meningitis is so potentially dangerous to the body. Right? It can kill you in a few days. But guess what can pass through the blood-brain barrier? The toxic proteins, the gingipains from the bloodstream. They create a permeability. They get through the blood-brain barrier. And in fact, in virtually 100% of the brains, the autopsy brains of patients with Alzheimer's disease, we've discovered gingipains in all of them. And the gingipains interfere with synaptic transmission in the brain. That's the start of dementia. Now in the brain, there is an immune response to the gingipains. That immune response is, mostly macrophages trying to engulf these suckers, and the byproduct is the formation of beta amyloid plaque. Now, most of the, if not all, of the medications that are on the market now attempting to treat Alzheimer's disease are attempting to reduce beta amyloid plaque formation in the brain. It's too late. People with high levels of beta amyloid plaque, which can be identified on X-ray, those people can't be saved. None of those medications, they've been out for a long time. Right. And these new ones got an approval recently that is a terrible drug. When it got approval, it just brought a lot of negative press. Very expensive, causes inflammation of the brain, probably shortens the life of these people. But it's kind of like if you got a leaky sink and you don't deal with it, and you go away on vacation and somehow the drain gets clogged, then what is going to spill over that sink, right? Out onto over the counter, onto the floor, down to the apartment below, right? Trying to clean up beta amyloid plaque, that's like mopping the floor without dealing with the problem in the sink. Right? The problem starts in the mouth. We've got to get the gingipains at the gum level. And Keystone Bio discovered a study, I mentioned it briefly before, 1995, Booth and his team in the UK got Guy and St. Thomas School of Medicine and Dentistry in London to approve a small-scale study, 14 patients with periodontal disease and high levels of P. gingivalis. Right? They treated them all with metronidazole first, which was thought to be effective antibacterial for the bugs in the mouth. They did SRP on all 14 patients. And then they irrigated 7 patients with saline and 7 patients with a monoclonal antibody that they found effective in the lab. It's a rodent monoclonal antibody, effective against P. gingivalis. And sure enough, when they followed these patients, the 7 that had been irrigated with saline, post-scaling and root planing, all had return of PG at full blast levels in less than a month. But the group that got the monoclonal antibody irrigated, the earliest sign of PG return that was demonstrated or noted in any quantity was 9 months. So we have a repeatable treatment that could be administered, at say once a year to supplement scaling with an irrigation. Now, that company is in trials with that drug right now. Trials are being done in Australia. So more to come on that. Probably won't be to market for another 3 years. But we potentially, as dentists, have the means to make a serious dent, not only on Alzheimer's, but on diabetes,
right,
heart disease, certain digestive cancers like esophageal cancer, pancreatic cancer, oral cancer, rectal cancer, everything from ED, low birth weight, non-alcoholic fatty liver disease, mental depression, all these things we've got early studies showing that there's a correlation. And we understand the pathway for not only the brain, but also for the liver with diabetes and for heart disease. We understand the pathway.
Correct me if I'm wrong on this, though, Ed, but I understand there's also some emerging information about periodontal disease and fertility. The ability to conceive, and it's emerging.
I've seen the studies on low birth weight babies with
preeclampsia,
periodontal, but I have not heard about fertility. That one I haven't heard.
Yeah, that one is emerging. We're in the early stages of it, but I love this pioneering work in the area of Alzheimer's and dementia.
I mean, when I heard about ED, I immediately went to the few offices that I still help with their Facebook pages.
Right.
Help them create a post mentioning that there could be a link between bacteria in the mouth and ED.
Right.
And, it's kind of like serious, but, kind of tongue in cheek. I ended the post with, "Do I hear the phone ringing in the office?" That kind of thing.
I think so.
But interestingly enough, so I signed on with this company. They wanted, I said, "Look, I can't help you with the science. I'm 40 plus years removed from my microbiology and dental school, but I can tell you nobody knows about this, and I do know how to market, and I do know how to reach dentists, and hopefully, and they thought that role was key to bring me on as chief dental officer. Now, a couple of weeks later, I happened to be listening to my oldest daughter, Randy, has a show on Sirius XM Business Channel, and which we, of course, listen to religiously.
Sure.
And she's talking to some guy, and he's talking about P. gingivalis, and I'm going, "Whoa, totally!
That's my language.
Totally independent of what I'm doing. What is it, Randy? You need to connect me with this guy." Well, it turns out to be Naveen Jain, who's the CEO of Viome. And Naveen and I had something else in common. My youngest daughter, Ariel, worked for his son, Anchor Jain's startup. So he knew my daughter, and they have a division. They were primarily gut health, but they were developing an oral product, which is out now, which I'm super excited to tell you and your listeners about. And they also are working on a pathway, a digestive pathway that they think is responsible for many instances of mental depression. So they actually have my wife as an advisor helping them with that.
And the name of the company is Viome Life Sciences.
Yeah.
Um,
Yeah.
we'll
And-
put, for our listeners' benefit, we'll put the links in the show notes for both Keystone Bio, Viome Life Sciences. Well, you all right if I put Revere Partners in there as well?
Absolutely, for sure.
Yeah.
So
Ed, as we come to the finish line today, I want to thank you. First of all, I want to thank you for your passion for our amazing profession. I've always said that dentistry rocks, and the reason I believe it rocks is we have the ability to change people's lives, and you are a living, breathing example of that throughout your career. Thank you for sharing your passion with our listeners. Emerging, I don't think if I know your story, and I don't think you were actively looking for a second career, but it landed in your lap, and it kind of ignited what has really been a career-long passion in these different areas. It's a cool combination of your skill set emerging, and you've been a nerd, and I use that term in a complimentary way. You've embraced technology from early on,
for sure.
and what a wonderful second stage of your career, serving our amazing profession. So thanks, Ed.
Thank you for having me. I love, spreading knowledge. And, at the start of the pandemic, when I thought that I might be riding off into the sunset, when I got involved with this stuff about, the oral systemic connection, my thinking was, if I died tomorrow, I'll be best known for my famous offspring. But I think I have a chance because of my name to open some doors that other people can't get open. And if I can help push dentistry to where it really belongs as a primary healthcare profession, and the early line diagnosis, with the potential of this monoclonal antibody, and with Viome's Oral Health Pro with Oral Cancer Detect, which is basically rolling out now as we speak, where dentists are going to have the ability to detect oral cancer earlier than ever, then I'm really utilizing the fortune that my family's had with, really giving back to the profession in the best way possible.
Well, Ed, I couldn't think of a better person to carry that torch than yourself. Thank you for the privilege of your time today, Ed. May I leave the door open to bring you back, and we'll continue some of these discussions in depth in the future? Would that be all right?
Love to. I'd actually love to go into Viome in depth, because I think that 6 months to a year from now, we're going to really see this being employed full scale in dental offices around the country.
Perhaps we can say they heard it first here at on the Thriving Dentist Show. I'll reach out to you, Ed. We'll schedule a follow-up specifically on Viome and their Oral Health Pro with Oral Cancer Detect. That's very cool technology. As we wrap up today, I also want to thank all of our listeners here at the Thriving Dentist Show. We appreciate each and every one of you. On that note, I'm simply going to say thank you for the privilege of your time, and we look forward to connect with you on the next Thriving Dentist Show.